Hello, good morning. Welcome. Welcome to the virtual workshop on lower back pain and sciatica on a beautiful Friday morning here in Edmonton, Canada. We have over 70 participants today from Canada, from US, and also from India and UK as well. So I'm so excited to see you all here on the virtual workshop. My name is Giri Srinivasan, physical therapist. I'm practicing for the last 22 years. And a lot of our caseload is lower back pain patients. So we used to do these workshops in the clinic. Because of the COVID situation, we took virtually, and we got a very good response. And I think now we're going to do a virtual workshop almost every month on different topics. So now I'm going to show the slides to you guys. I'm going to share the slides with your screen right now. So give me a minute. There you go. So you can see the slide there. Everybody's good? Okay, so welcome again, virtual workshop on lower back pain and sciatica. Why lower back pain? We got to see that. Again, let me bring my cursor here. I'm working with multiple screens here, so there you go. Why I choose lower back pain and sciatica workshop? Because it's a universal human experience. Almost everyone has it once at least in their lifetime. That's the main reason. And also it's only second to the headache when it comes to frequent location of pain. That's why sometimes, headaches is number one and lower back pain is number two. And then they say at least 4 out of 5 adults will experience lower back pain at least one time in their lifetime. And also, as you see there in the slide, it's one of the top main causes for the missed work. So, I know it's, I'm so used to be audience in front of me. Raise your hand, I said. In your Zoom box, there is a small tab underneath saying raising hands. You can click that. That's how you raise your hand in virtual workshop. You can raise your hand if you have a back pain or sciatica in the last 30 days, right? Just a kind of a feedback, traveling inside to ask yourself some questions. If you had, how long have you had it? And where is the pain? Is it in your upper back, mid back, lower back, in your glutes, or in your sacral area or the tailbone area? Where is it? And what makes it worse? And what have you done to make it better? Just brainstorm those questions in your brain. We'll address that as we go along in this webinar. So to start with, we are going to debunk some of the myths, which is commonly you hear from your friends or family or other people, co-workers about the back pain. Some of the myths we commonly hear is just right here on your slide right there, my back is tough and stiff and it's going to be like this forever. A lot of people think that back pain is going to be there all their life. No, it doesn't have to be. You can change it. It's in your hands, right? So, and also when I hurt my back, I just have to lie down all the time. No, you don't have to. You have to be active. I need a scan for my lower back. We're going to discuss more about this MRIs and X-rays down in the path in the webinar here. But that is not the way. You're not going to treat your lower back by doing a scanning, X-ray or MRI. It's for different reasons, for more appropriate people. My back is weak. Yes, it can be, but you have to do something about it to make it stronger. My back is out and needs to be put back in. This is the common thing we hear. This terminology is used by some healthcare practitioners in the field. But to me personally, that's not the right word I would ever use for the back pain patients. That something is out, I have to put it back in. If your back is out, you will be in ICU with the morphine drips. You won't be walking into the clinic, right? So what they mean by when the back is out, they mean that something is not moving the way it's supposed to move. We have to make sure it moves by means of manual therapy or exercises. That's what it means. So I don't want you guys to imagine that what is supposed to be like this, it's like this, and somebody's going to do this to me. No, it's not like that. My back aches all the time, and there's nothing I can do about it. You can definitely do something about it. The right advice is your best pain medicine. Remember this, okay? This is one of the take-home message. It's not your Tylenol or Advil. The right advice from the right healthcare professional is your best pain medicine. Hope everybody is doing fine. Feel free to move around. If you're sitting in the chair, try to stand up, stretch out a little bit. It's going to be another 45 minutes with me, so hang in there. So we're going to talk very gently about lumbar spine and disc. So this webinar is for the people, for the patients, right? It's not designed for the healthcare professionals. So it's going to be very basic, very much in the layman term. I'm going to explain in the layman terms so that you guys can understand and you guys can appreciate it. Okay. So you can look at the picture here, the lumbar spine, and you can see the vertebrae in the kind of a gray column. And you see the discs in between in the purple color. And also you can see the spinal cord in blue. And also you have the nerves coming out of your spinal cord, right? It's blue color as well. The nerves coming out of the neck is going to go into your arms, and the nerves coming out from the middle go around the ribs, and from the lower back is going to go around in the legs there. It goes all the way up to the foot. Just to give a small glimpse of the anatomy of the lower back spine. Even though I'm just showing the lower back spine because the topic is that when we treat the spine, we treat the whole spine from the occiput to the tailbone. All right, that's how the spine functions. A lot of regional interdependence in the spine. We don't just work on those 5 vertebrae in the lower back. That's not how it works. Okay, because we're talking about sciatica as well, a small slide there about sciatica. And you can see the sciatic nerve, which travels from the lower back. It travels in the back of the leg. It goes all the way down to your foot. And it goes through different muscles, a different facial system, and also you go through all the way to different anatomical parts. When we treat sciatica injury or sciatica pain, you're not treating only joints and bones and muscles. Very important area or structure we are treating is the neuromyofascial web, which is there from your forehead to the toes, different lines, different ways, because fascia is the one the nerves and blood vessels are piercing through to going through different areas. They are the ones which is dividing your muscles into compartments. You know, sometimes we say when we study anatomy, we have 600 muscles, or we can say, do we have just one muscle divided into 600 pockets by the fascia? You know, it's the other way of thinking. So we do a lot of work on the fascia for this kind of situations as well. You have a tight fascia in the lower back that can affect your function as well. In the calf, it can affect your function as well. We'll talk more about that later. Okay, what is sciatica? I hope the speed is okay. I'm not going too fast for you guys. Sciatica, the sciatic nerve is the longest nerve in the body, and it's actually made up of 2 nerves. And you saw the picture, it starts from the lower back, it comes all the way down to your foot. Okay, so what happens to the sciatic nerve? You know, people who do gardening, it's springtime, everybody's out there, I see, you know, when you spray the garden hose and that loses pressure, why? What's happening? How do you fix it, right? And you just unkink it. That's all you do. So that's the same thing we do as healthcare professional to start healing the sciatic nerve, right? It can get pinched. It can get pinched by the joints in the spine. It can get pinched, some osteoarthritic changes or some inflammation in the muscle, inflammation in the area. It can compress the nerve root, and it can kind of get pinched anywhere on the root. The root you saw there, anywhere there, it can get pinched. The facial restrictions can pinch it. So we just have to find out what's happening, and we have to do certain things manually and by exercises to kind of unkink that nerve so that it cannot give you the pain, tingling, and weakness. We see that here. Some people complain heaviness too. So let's go to the next slide. Come on, where is my mouse? There it is. Is there hope? How can we tell it's possible to heal naturally? You're going to find out. Definitely there is hope. Otherwise, I wouldn't be doing business for 22 years. Common activities that make this pain worse. This pain means back pain and sciatica. Everything. You hear everything from the patients, right? Sitting, standing, walking, bending, lifting, carrying, pulling, pushing, rolling over in the bed, getting in, getting out of the car, right? Gardening. So many things can increase the pain in the back and the sciatic pain. So let's talk a little bit about the pain. Pain itself is a bigger topic. I actually planning to do a virtual workshop on just pain, pain 101. What is pain, how we perceive it, what are the things we can do to handle it? That's maybe down the road. We are planning for a virtual workshop just on the pain. Because the pain science has changed quite a bit from the time I was in school till then in the last 22 years, right? It's totally changed from this end of the spectrum to this end of the spectrum. How we saw pain 20 years before and how we see pain now, it's totally different. Anyway, pain is an indicator that something is wrong, for sure, right? What do most of us do when the car engine light comes on? We pay attention to it because it's a serious problem and we take it to a technician, we take it looked after, right? But when our body sends the signal of pain to us, what most of us do, right? You ask yourself, what do you do, right? If we have to start listening, it's not like there's no, no pain, no gain. That's there only in the last part of the rehab. When there is pain, there is a reason why it's hurting you. We have to address the pain. Okay, so pain box. Pain signals happens in your body. It interferes with the things you do, right? So when you bend, when you get pain, what do? You stop bending. When you run, you get back pain or the leg pain, you stop running. Is that the right approach? Or is there anywhere else or any other approach you can do? There is definitely hope. So this is another take-home message, right? And first one I already told you, the right advice is the best pain medicine. The second take-home message is right here. If the pain is reproducible, it is usually reducible, right? This is what we do as healthcare professionals, right? It can be a physiotherapist, it can be a chiropractor, it can be a massage therapist, or it can be your body specialist or body work specialist. We call all of us comes under the category of spatial medicine. That might be a new word for you, spatial medicine. What it is medicine of understanding and learning and working with how body moves in space, how we align our body in space, right? That is the spatial medicine. Yeah, we are a spatial medicine professional. And if I can reproduce your pain during my examination, most likely I can reduce it. So that's what I want you guys to understand. And when we assess you, it's not the lower back we are assessing. We're assessing you from head to toe. Starting from the body reading, we are doing every segment and identify what are the missing links in your body, and then chart it down and work on those missing links with corrective exercises, manual therapy, and everything what is needed. It's no easy task. It's hard work. Good news is when the pain is reproducible, there is always a cause. That is the most important thing. And when there is a cause, we can handle in physiotherapy, right? That's why I said there is hope. Sometimes if your pain is not coming from any of the activities what we mentioned, right? Seems to be no reason or there's no pattern for your pain. Sometimes it may be something else. Sometimes we may want to help you. So that's when we assess, when we identify those red flags, we'll refer you to the appropriate channels. Maybe you need more examination. Maybe you need an MRI. Maybe you need a functional MRI, whatever you need. Maybe you have a tumor in your lower back. We don't know, right? So when we see the red flags, we'll send you to the right channels so you can get treated for that. Sometimes your visceral organs also can shoot the pain into your lower back. Sometimes something else can cause pain in the leg as well. Not all the pain which is going down in your leg is sciatic pain. So what is the most common mistake people make in handling pain? Okay, we are almost 13 minutes into the thing. So if you want to stand up, do some extensions, some rotations, move around. If you want to grab a water or tea, go ahead. I'm going to have a sip of tea because I've been talking a lot. Because we are doing so much tele-rehabilitation in the last 1 month, we just keep talking so much. So anyway, let's get back into this. What is the most common mistake people make in handling pain? Any guesses? They ignore it. That's the most commonest thing. Actually, ignoring, I would say, I would blame the male population quite a bit for this. They are very good in ignoring the pain. At least our female population, they don't ignore that much. They try to address it as much as possible. But the husband population or the male population, they need to be pushed to come and get help. You can relate to that to your personal life as well. They definitely ignore it. And then the another group of people, they try to alter it. We're going to discuss more about this going down, how they do it. And only some people, they try to handle it or fix it, right? And that's what everybody should be doing. Ignoring the pain. Why people ignore, right? That's the most easiest thing to do, just ignoring it, right? So you don't make any attempt to work on it. And we are filled with excuses. So what are some common excuses we see in the clinic, right? Here you go. I have a small list, and the list goes big, but I just put only a few in there. I always had a bad back. Never think you cannot change, right? Our human system, our brain is always changing. Our facial system is always changing. You know, it takes about 2 years to change your facial system into kind of a different structure or different tensegrity. So you can always change that. I have arthritis. Arthritis is another thing, right? Arthritis in my books is not even a disease. It's an aging process. It's kind of wear and tear of your cartilage and other structures as you live longer, right? So you can't drive a car, right, for 60,000 kilometers or 100,000 kilometers and not expect the tires to wear and tear. That's the same thing happening to your cartilage. So it's not even a disease. It's the aging process. We just have to understand the physiology and the pathology. And then we have to go with like, you know what? Yeah, I have this. So how am I going to handle this? I'm going to take on and I'm going to get better. What I have to do to keep moving, keep doing my activities. That's how you have to think about it. I don't have time. I'm too busy. A lot of people, you see this doing that. If you don't have time for yourself, how can you take care of others, right? It's an old injury. Nothing can be done now. I have tried everything. That's another thing, right? Yeah, you might have, but how do you know everybody worked on your cause or the problem, right? People sometimes chase around your symptoms, which is not going to go anywhere. You just go in circles. I exercise already. Yeah, you might be. You might be going with Dr. Google or Dr. YouTube or anything like that. But how is it going to help, right? Because some healthcare professional like a physiotherapist or chiropractor or any healthcare professional, a bodywork therapist or a special medicine specialist has to work with you to identify, individually assess you and identify what are the missing links from top to bottom, what are the movement patterns you are abnormal, what are the postural patterns which are abnormal, and then they have to create an individualized treatment program which can be graded, right? That's what you need. You can't just grab a couple of stretches from there and do it and expect to have 100%. No, you can't. And it runs in my family, yeah. And I had MRI and having bulging disc. We'll talk about that later. I don't want to go into that point now. Let's move on to the next slide. I hope everybody's doing fine. Why do some people stay active into their 80s and others don't? The reason, genetics, maybe a very little. Magic pill, I don't think there is one. If you know anything, please let me know. It's only hard work, I told you, So it's all about how we handle the problem, right? If you ignore your pain, you're not taking action, because taking action needs the determination and motivation and the time from you and the dedication from you. If you don't have that, it's hard. If you handle it well, you're going to be dancing into your 90s without back pain. And this is the second group of people we talked about, choice 2, right? Altering the pain, how they are altering the pain. Usually these people will do certain things to block the pain in a very short frame of time. It can be your pain pills, it can be your hot pack, it can be your little bit of stretches here and there that wears off the pain a little bit, but it comes back after some time because it's not a permanent relief. There are a lot of things you can do for a temporary altering the pain response. A massage, which is only relaxation massage, that's not addressing the cause. We have some wonderful massage therapists and yoga therapists are here in Edmonton, and they have to understand the cause of the problem and work on it. But if it's going to be just a relaxation once and not working on the cause, it's going to be a temporary. And also foam rolling is another big concept in a lot of people. They'll roll the heck out of those muscles and fascia. And foam rolling has very, very, very definite indication when you do it and where to do it and how to do it. I feel a lot of people are overdoing it. And that's another topic to discuss anyway. Let's not go there. And pills, yeah. You take first dose of painkillers. If it doesn't kill your pain, then you go to your doctor. You get little more stronger painkillers. If it doesn't kill, and you go a little more stronger, then you go to narcotics and opioids. I've seen people coming with opioid patches and all. So you wonder why? Because that's not the right way to go up on that. And even some surgeries sometimes doesn't work because you never corrected what's wrong. You just chased your symptom. Okay, time for me to take another sip of tea. Please grab your water or tea, whatever you have. If you're looking for a long-term permanent relief and want a healthier body, you want to address the cause of the pain, right? And if you're motivated, if you have time for yourself and you're determined, you can heal your pain. I love this group of people, they take actions, they handle the pain. They try to find the cause of the pain and use the right treatment there. And this is the only way you can get long-term permanent results, right? As physiotherapists and the body specialist, we find out the cause of the pain, do a thorough assessment, treat the signs and symptoms, and also develop a treatment plan, right? And then go with the plan to take you to the finish line. That's what we do for a living. So now little questions for you to brainstorm a little bit, right? Think of the worst pain you ever felt in the past year. It can be past year, past 6 months, or past 6 weeks. Think the worst time you had it. How did you handle that pain? What did you do? Did you ignore it? Did you try to alter it? If so, how? Or did you handle it? How did you handle it? And whatever you did to handle it, how much it helped? How much time commitment you put in there? How much determination? How much exercises you did? And how did it help? Just think about it so you can find some answers within yourself. And why it is so important to find the cause of your back pain. Because we see like a lot of back pain and sciatica sufferers who kind of have a lot of failed approaches, right? Failed attempts, failed surgery. We see a lot of failed surgeries, especially the disc prolapse, failed injections. Just putting a corticosteroid injections in the joint can relieve your pain temporarily for a month or so. Is it the permanent solution? I don't think so. So that's another thing. And also, no relief with some chiropractic or physical therapy care who are just chasing the symptoms without addressing the real root cause of the problem. It can happen. Does this sound like you? You know that. You know the answer for that. We have a lot of success stories of patients. We usually track these success stories. Very interesting. We do have 9 clinics affiliated with us in the city of Edmonton, Beaumont and Sherwood Park and Redwater. And we have a lot of success stories, and you can check our reviews. I think Instep already have about 130 Google reviews. A lot of our clinics cross 100 reviews. A lot of success stories. We are very happy about that. And I just want to tell you guys, share a small success story what happened in Instep, just to motivate you guys. I saw this architect a couple of years back from a leading architect firm in Edmonton. And when I first saw him, he was referred by one of our old patients actually. When I first saw him, he took 6 pain medications in a day, along with 2 opioid patches on both shoulders. That's what he came in with, a lot of pain, right? And we did a thorough assessment. We worked with him. He worked with us for almost 6 to 8 weeks. And then every week his pain was going down. Every week we were able to bring a couple of painkillers out of his medication list. And in 4 weeks, we took all the medications off. In 6 weeks, we took opioids as well. And he was very happy with that. Plus his pain was improving. We go more into the functional activities. He used to drive to Calgary for work, and he's able to sit in the car for the drive for 3 hours driving to Calgary. He doesn't have to cry every 30 minutes, stop and pull over. And he's very happy. Now he's in Calgary now. He wants in 3 months when he comes to Edmonton, he comes and sees me. This is just one success story. There's a lot of success stories. Why I'm telling you this is, don't say that I can't change anything. You can. It's in your hands with the right help. So what causes low back pain? Just I'll give you a second to look at the slides. Right here, what are the causes? We're going to discuss more about that. We're going to only discuss about the 3 most common causes of back pain sciatica. There is numerous. Then we have to do this webinar almost for a month to discuss all the causes. We're going to take the top 3, then we're going to discuss that quickly. Oh, I told you I'll get back to this later. By the way, we see a lot of people fixated on this investigations, MRIs and X-rays. They don't actually show the whole picture most of the time. And not everything you see there is what you feel. It's always nice to say, oh, this is why my back hurts. It's always nice to have something to point at, but that's not how the body works. I still remember I was treating this patient last year, and during the assessment, the first thing, he was in tears. He couldn't even sit straight. The first thing he did was, he took his cell phone out and he showed me this picture of his MRI in his cell phone. Giri, look at this. Look at my disc. That's what hurting me, right? And I told him, can you please delete that picture? That's the first thing I did. And because he is catastrophing with this pain just by that picture every single day, right? Then what are you doing to your neurons? What are you doing to your brain? You're just making your neurons to have increased perception and amplification of pain. Normally when I prick you, maybe 10 neurons will go pain, pain, pain. When you see these kind of pictures every single day, you're going to recruit 1 million neurons to go pain, pain, pain. Do you need that? You don't need that. That's why I told the pain neuroscience have come a long way. You think it's from your body, you think it's from your disc, you think it's from your muscle, you think it's from your sciatic nerve. Maybe it starts there, but very soon it transfers to how your brain behaves and how your brain responds to pain. I want you guys to understand that point. Very, very important point. So that's why MRI I was talking about. Herniated discs, this is cause number 1, big issues. When I say herniated disc, it's coming out. Sometimes it can be bulge also. So these people will have pain with bending forward, twisting or lifting, coughing or sneezing, right? So these are the things, coughing and sneezing especially, it increases the intra-abdominal pressure. So when that increases, it increases the spinal pressure, that pushes the disc a little bit, so it causes more pain. That's why anything you do to increase your intra-abdominal pressure can cause pain with this kind of condition. Sometimes if you have to struggle a little bit to go for washroom and stuff, you can get the pain as well. Or in our Edmonton weather, in the winter time, you have to push a car holding your breath, it can happen as well. A very common age is 18 to 35 years. Are these common? Coming back to the MRI again here, if you took an MRI of 100 random people without back pain, how many people do you think will have disc bulge? Just give a guess, any number, give a guess. 80%. 80% of the people will have disc herniations or bulges on MRI, but do not have any pain. Go figure that out, right? What does that mean? Well, that means you can't rely on just MRIs and X-rays and what you see there. You can have issues with no symptoms also, but when you get symptoms, that issue is not the only reason. That's what I'm trying to say. Okay, your disc, what's the function of your disc, right? Your disc acts as like a shock absorber for your spine. Like, just cushioning up the spine a little bit. It's like a fresh grape, that's how it looks like. And you have this center gel, it's called nucleus pulposus, and you have surrounding fibers. The fence is called annulus fibrosus. You can see in that picture here, nucleus pulposus, it's piercing through the annular fibrosis and then coming out and putting the pressure on the nerve root there. That's the picture you're seeing there. It can happen with because of so many reasons. We're gonna talk about it. It can be from repetitive stress, repetitive bending, lifting, especially guys who work in the warehouse and stuff like that. I see a lot of this problem, or in the construction. Those guys sometimes have to lift a lot of heavy kind of things. And also it can happen for a kind of trauma also, car accidents, sports injuries. These fibers, the fence we talked about outside, that can break down, and the gel can come out and put the pressure on the nerve, right? So when the gel comes out and put the pressure on the nerve, that nerve gets irritated, and that can cause pain or tingling or weakness in your legs where the nerve supplies, right? Weakness is the last thing. You won't get weakness right away. The compression has to be too much for you to get the muscle weakness. Usually you get a lot of pain and tingling and numbness in that area, in the referred area. Most common level is lumbar vertebrae 4th and 5th in the lower back. That's a common area for this kind of conditions. We are moving on to the cause 2. I hope everybody is doing fine. We are almost 30 minutes into the webinar. Time for another sip. My tea is cold anyway. Okay, arthritis, stenosis, and disc degeneration. I already told about arthritis, wear and tear of your cartilage, age-related. To me, it's not a disease. It's aging process. Stenosis, you see in the picture there, you can see the narrow spot when the bulging disc is kind of narrowing the spinal canal there. You can see that spot where it says stenosis. Stenosis means narrowing, narrowing of the canal, right? And also disc degeneration. It can happen with the age. Same like what's happening to your cartilage, it can happen to your disc as well, right? So this group of people who have either stenosis or arthritis or disc degeneration will have a lot of pain in standing and walking. Why? We'll discuss that. And usually 50 plus in the age, and they'll have relief sitting down. So if you identify someone or you yourself, if you have pain with standing and walking, that goes away when you sit down and you're 50 years plus, there is 99% chance that you have one of these, either arthritis, stenosis, or degenerative disc disease. Here's how it's work. Look at the picture, right? You can see, compare your healthy spine, then osteoarthritic spine or edge spine there. You can see the shape of the vertebra, how it's changing, the disc, how it's changing, losing the water content, and you can also form some bone spurs in the end there, and the discs narrowed, because we all shrink as we age. If you measure your height, you will know. As we age, our height goes down because the disc height goes down. So we have so many discs in our spine, so we lose our height as well, right? So when this changes happens, the canal where the nerve comes from, that kind of gets smaller, then that pinches the nerve, you get the pain down the leg as well, right? The more common level is L4, L5, which is your lumbar spine 4 and lumbar spine 5 in the lower back. So when we stand, it's extension. When we walk, it's extension mostly. So the hole gets more smaller. That's why you get more pain. That's why this group of people will get more pain in standing and walking. But when they sit down, they put some flexion into the spine, the hole gets a little bigger. That's why they get some relief in sitting. And there's a group of people like this. They will tell you exactly. That's why we ask, what are the factors aggravating your pain and what is relieving? So that history gives us some idea about that. Every question we ask in the subject examination, there's a reason why the body specialist asking you that question, because that history is very important to us. Is it possible to be normal again with all these things going on? The short answer is yes. You're not going to reverse those changes happening in your cartilage or the bone, but you can find a way to work through that and live symptom-free and do the activities you enjoy can do. The third cause is sacroiliac joint and pelvis. In the picture, you see that the pink area, that's your sacroiliac joint. I'm going to show you the model later. This is probably the most missed cause of back pain and sciatica that we can see, right? Why? Because a lot of people, when you go for things back pain, they only look at the back. They don't look at your pelvis or how your tailbone is moving, how your pelvis is moving. It's usually missed in the examination, and also when you order for x-rays or MRIs, they only do the lower back. They ignore the pelvis. So that's why it's mostly missed. These people will have different kind of symptoms and subjective history, right? They have a lot of pain in changing positions, especially rolling over in the bed, because they have to move the leg over. The sacrum and pelvis has to kind of tilt a little bit. And getting in, get out of car, any kind of pivoting movements, getting in, getting out of the bathtub, right? And walking up and down stairs because you're doing in single leg standing. There's more shearing forces going on through your sacrum and the pelvis, right? And sitting for a long periods of time, crossing the legs, getting dressed because they have to stand in one leg. Because not a lot of people stand anymore to put their socks on or the panties on. They all find a chair because we don't have good hip stability. So that time they'll have pain too. So this pain can sometimes shoot into the groin as well. And that's a common complaint we hear. And these people also can have pain and numbness and tingling. So if you suffer with back pain and try treatment which didn't work, you have a good chance that you might have a SI joint or pelvis issue. Hope everybody is with me so far. Okay, here how it works. Look at the picture there. Which is the most important block here? The top block or the bottom block? You know the answer. The bottom block, it is the foundation. The foundation for the bones in your spine or vertebral column is your pelvis. I'm going to take this model here. Then I'm going to show you guys here, right? See, this is your sacroiliac joint. And this is your pubic symphysis joint, the joint in the front. So you have 3 bones, 1, 2, and 3. And you have 3 joints, 1, 2, and 3. And you got a lot of muscles, big muscles attaching in this guy in the front. Your big abdominal muscles are attaching here. Your leg muscles are attaching from here quite a bit. This is an important junction. It has to be really stable for this. And same here. There is numerous muscle attachments and also facial attachments here. The fascia in this area is quite fascinating. It's connecting your leg muscles into your back muscles, into your upper back muscles. The facial system here is very unique and very impressive. Let me put this back. Okay. Oh, here I forgot to mention something here. How stable is your foundation? It's easy to find out, okay? Let's do a quick test, everybody. People who find it safe to do it, only do it. All you have to do, you have to stand up. Just push your chair back. Step back a bit from your desk, wherever you're sitting on. Put your hands on the waist. Again, do this only if you feel safe. I don't want anybody falling on this, okay? Then I want you to bring your right leg up towards your chest and see if you can stay there. Then come down. Then repeat with the other side. That's a small stability test. And see how you're doing. Are you doing, when you go up there, are you doing kind of any dances on both sides? That will tell you how stable your foundation is. That's a small test. And you can also progress the test in different ways. But that'll give you a picture of how stable your foundation is. If that foundation is not stable, you're barking at the wrong tree, right? So you have to stabilize the foundation first before you work on the spine, which is a structure sitting on this foundation, right? So see, how is your right hip stability? How is your left hip stability? How strong is the foundation is? That is why a lot of our lower back pain patients always have hip stability program blended into their exercise program. That's very, very important. So we discussed that. I showed you the model in that quick review of the anatomy there. You can see those sacroiliac joints in the back and the pubic symphysis in the front. Those are the three joints. You see the nice, beautiful architecture of the pelvis there. It's a fascinating anatomy, and there's so much going on in that area. All these joints, three joints, needs to be stable, and also there's not actually a lot of movements in these joints, very, very minimal glides, and mainly the stability. These are built for stability. It's in the middle between you're connecting your trunk to the legs, which is moving quite a bit. You need that stability in that platform to execute the movements in the legs and transfer forces as well. When the sacroiliac joint is not in proper position, right, it puts pressure on the top. What's on the top? Your lower back, especially at the L5, S1 level, it can put pressure on it. Then you can have problem there. So we talked about three different scenarios here. So you guys can relate that to your symptoms. Where do you fit in? Do you fit in any one of these three categories, or you don't fit in there at all? Then we have to do further examination. It may not be your lower back. It may not be your sciatic nerve. It may be something else or some other causes. We have to find that out, right? Even a very strong active trigger point in your gluteus muscle can shoot the pain down into the leg. Not all pain going down in the leg is sciatica, right? We have to find it out. So what is the key to the successful treatment? The key to successful treatment is finding the cause of the pain, number one, assisting the body's natural ability to heal without pain medications, without corticosteroid injection, or even without surgery in most of the cases, okay? And also education. Education is empowerment, right? Education and also learning about how to uncouple pain and movement. That's a very important thing. A lot of our time goes in explaining that to the patient and making them understand. So what are the things you do to uncouple pain and movement, right? So you have to first understand pain doesn't mean you're damaging something when you're moving. When you bend forward, you got pain, that doesn't mean you're damaging something badly there. Oh my God, it's hurting there. Maybe I'm damaging my disc, I should not bend. It's not like that, right? You can be sore, but your therapist will teach you how to do safe movements, right? That's very important. That's how you uncouple pain and movement. And also build your activity, what you like to do, slowly. Go up level by level. That's why our exercise programs are graded, right? We're not going to give you 25 exercises on the first visit. You will start with one and then level 1, level 2, level 3. It's all graded up there. And also we help you how to gradually expose yourself to the activity you love. You either gardening or golfing or whatever you want to do, or sitting and working, how to expose yourself gradually. That's where the gradual exercise program comes in. And over time, your activity tolerance will improve and your pain will likely reduce, right? So that is one important take-home message. This is the third take-home message today I want you guys to understand. Again, we'll discuss more about pain and these things in Pain 101 webinar coming up soon. So what's the best treatment for your pain? There are many different treatments available, right? So what are we going to choose? Here at Instep Physical Therapy and Affiliated Clinics, as I said, we have about 9 clinics in and around town. For in-person visits, we use lots of hands-on manual techniques because all our therapists are minimum 15-20 years experience with multiple manual therapy certifications, masters, PhDs, certified board specialists, orthopedic specialists, and we have all these people in our team. We are very fortunate to have great physical therapists to do a lot of hands-on work. Manual therapy, it means it's not only just working on joints, manual therapy, spinal mobilization, it's also working on myofascial structures. A lot of soft tissue work also involved in that. And we all also have some great massage therapists in our team as well, right? And we work with a lot of chiropractors in our team as well, right? And followed by the graded individualized exercise program. That is the most important thing. 3 treatments that have stood the test of time for the neck and back pain. Why I didn't just put back pain is I always treat the spine as a whole, never just the back. My back pain patients, we start from the neck. So that's what we do all the time. So definitely manual therapy, hands-on, different grades of spinal mobilizations and soft tissue work, neuro re-education of muscles. Because brain has this amazing thing, right? When there is pain, it just shuts down your muscles. It says, you know what? Just shut it down. No, you have to learn how to reactivate those muscles. With the lower back pain patients, I see a lot of times the gluteus is shut down. It's just shut down totally. They can't even lift the leg backwards and they're lying down the tummy. They love, first thing is pain, then they can't even activate the muscles. So a lot of gluteal stuff we'll work with this kind of patients. And also stabilization exercises. We saw how stability is more important. It's not only the spinal stability, it's also those hip stability. And when it's not hip, it's not just the hip. We're talking about the whole chain, hip, knee, ankle, but predominantly hip and pelvis stability is very important for you to treat the lower back issues. So now we have, everybody know we are all here in the COVID situation, and physiotherapy is a little different. I think at the end of March, we closed our clinic for regular patients. We only saw emergency patients for the last 1 month. But tele-rehabilitation physiotherapy, it's been awesome. We've been enjoying. That's why I told you, I've been speaking a lot in the last 1 month. It's quite exhausting, but we really, really enjoy it. And even with tele-rehabilitation physiotherapy, without touching the patient itself, just with the right advice and right exercises and analyzing the movement patterns through video and then teaching them what to do, ergonomics and everything, we were able to bring the pain out quite down, like from 8 out of 10 to 4 out of 10 in 2 weeks, a lot of people. Now, you know, that's what we did in the last 1 month. Now, the good news for us in Alberta is we are opening the clinics this Monday, May 4th, so we can see our regular patients and help on hands-on therapy as well, right? Your body can heal itself. We just have to do the right things. So the formula for the permanent relief, manual therapy, and or individualized exercises to restore normal movement, and also your body in space, how it is, right? And the body reading, that's also very important. And corrective exercises, because when we have pain, as I told you, the muscle shut down, you develop compensatory patterns. That's what brain does. Brain does not activate muscles separately. Brain doesn't say, hey, glute, you fire, hey, piriformis, you fire. No. It activates movement patterns, right? That's what the brain does. So when you have pain, you will have abnormal movement patterns, okay? You can't separate neurology and orthopedics. It's always together, right? Then to find out those abnormal movement patterns and adaptive patterns and teach you guys the corrective exercises and also teach you guys exercises to facilitate that underworking muscles. That doesn't happen in 1 day. It's a hard work, your time commitment, our time commitment, and the determination. It usually takes about 6 to 8 weeks. That's all it is. There is no magic pill we talked about. It's only hard work, right? If you're not ready to put that commitment and hard work, it's hard for you to kind of get out of the lower back pain issues. Success doesn't come to you. You got to go to it, right? So because you guys took your time to attend this free webinar, and for almost an hour now, we are offering you a free discovery consultation, either through tele-rehabilitation or in-person visit in the clinic. You have to call and make an appointment for that, right? And in this free consultation, we'll just few things. We'll just check on the movement patterns and tell you what might be the successful treatment plan would look like for you. Then it's up to you to go ahead or not, right? And you can message your name and phone number. There is a chat column underneath in the Zoom where you can put your name and phone number so that if you're interested in the exam, so our office manager will call you to schedule something. Also, you can call the clinic as well. The phone number is there on email also, so we can help you in that way, okay? So how does it help when you're not in pain and discomfort? Because you can be less absentee from the work. You can go for long drives now, finally, sun is shining beautifully outside. And you can also spend more time with your family and friends and enjoy your beautiful outdoor recreational activities as city opens, as the province opens up for more, right? So at Instep Physio, you see that succeed in life, you need three bones, they say, a wishbone, a backbone, and a funny bone. But as a physiotherapist in Instep and our affiliated clinics all around the town, we are here to give you a strong backbone that can make you the best use of your wishbone and the funny bone. That's exactly what we do for a living, right? And just a list of our affiliated clinics in town, in case if our clinic is Instep Physio is in downtown, right? If it's too far, and then these are our affiliated clinics in our neighborhoods, so you can approach them as well. And we have some wonderful therapists in all these clinics here. Trust me, you're in safe hands, because that's the only thing we know how to do it. You ask me to fix a fence, I don't know. I only know how to fix a body, right? So if you have any questions now, this is the end of the webinar. Hopefully it was some information good for you guys to listen. And if you have any questions right now, I can't see any of you, I can't hear any of you, but you can type in QA column, question answer column in the webinar in the bottom of your screen, You can type in there. I can see your question, and then I will answer it in the video one by one. And thank you so much for listening. Now I'll take your questions. Okay, let's see what's questions coming up here. Q&A. Yeah, go ahead, ask the questions, whatever you want to ask, and I have time to answer your questions. Okay, I guess nobody had any questions. So that's the end of the webinar today. Thank you so much for joining me. We'll be in touch soon. Oh, there's one question coming right now. Okay, what's the question? What is a common exercise for sciatica like we can suggest at home to patient? Okay. Again, it's a very tough question to answer because there is no common exercise, right? You have to assess the patient to find out what is their problem is. You can't just say plug 5 exercise from somewhere and say go and do this. That's not how it works. So I'm sorry that there is no common exercise for sciatica. You have to identify and you have to assess and then prescribe the exercise. It's like prescription. Exercise like prescription. You have to prescribe based on what they need, right? And you basically a lot of activity modification also they have to do, and based on what they do for a living. And then it's better for them to kind of approach their healthcare professional, a physiotherapist or the chiropractor or somebody, and to get assessed and get prescribed, individualized prescribed exercises for them. I don't know any common exercise for sciatica because I don't give any common exercise to everybody. There's always different exercises. Another question is, I have had acupuncture and I find it works best. Is that the sciatic nerve? Yeah, acupuncture is helpful too. We do quite a bit of needling as well. A lot of our therapists do acupuncture and dry needling as well, which is dry needling and intramuscular stimulation as well. For certain conditions, the acupuncture and dry needling can definitely help. Sometimes when you're really acute, when you calm down the system, acupuncture really helps. And also when you have some active trigger points in your muscles, which can also shoot pain into your legs, that time also we can desensitize those trigger points by doing acupuncture and dry needling. That's very helpful as well. Oh, questions started coming in. That's pretty good. Okay. Can I perform the same exercise that you gave me when I came for treatment? I have the same pain at my back I had twisted when doing my exercises. Okay, so when you have a new pain like that, it's better for you to get reassessed and then get your new exercises prescribed from your therapist. Once I get severe pain in the back and leg after a bending activity, what we should do immediately? Okay, when you bend, you get sharp pain. That means that somebody is not happy in your lower back. Somebody is under stress. When you bend, somebody is not happy. So you have to find out who is that person who's not happy and why bending causes him unhappy. You have to find out the reason. Is your bending movement is okay? Is your hip is okay? Your ankle is okay? If your neck is okay? And are you moving properly? Then you have to find out which structure is hurting. Then you have to address that problem. Find out the cause first, then address the problem. That's what you should do. Again, there is no magic exercise I can give you that to work on. You have to go to your therapist, healthcare practitioners to get it assessed, and then we can prescribe the exercises for it. If you have severe pain, you can avoid the activity and then see your therapist and go from there. Okay, let me see some more questions are here. Go down. Okay. Let's see more questions coming in. Anything more? Okay, what is your opinion on cupping therapy? Okay, cupping. Cupping does distraction, right? Basically, that's what it does. So sometimes the facial structures is not gliding very well, right? We have different layers of fascia, and different types of fascia. So they don't glide very well. When they don't glide very well, they get tangled up or dried up. So sometimes we can use cupping to distract those layers a little bit so that they can glide with each other, muscular with fascia, fascia with your dermis and everything. So when you identify that there is some soft tissue gliding issue or tightness, you can use cupping to distract those tissues so that you can get some more gliding between those membranes. And you can always check, test and retest and reassess how the pain changed, how the movement changed after cupping. Cupping alone doesn't work because you do cupping, you distract the layers, but you have to teach them how to move properly, teach them the things to get it going, right? So cupping is definitely a good adjunct therapy. It has to be coupled with exercises. Okay, next. Can I get nerve burned by surgery? My back only hurts when walking and standing. I have 8 out of 10 pain. Okay, he's talking about radionuclear ablation surgery where they go and burn the nerves. It is usually done as a last resort. When everything you did, nothing works, then I'm not a big fan of that surgery because you can't shut every mouth which is speaking by just putting a tape on it, right? Your pain is 8 out of 10 as well. So I'm not sure how you have handled your pain so far. So, but don't jump on burning your nerve right away. Maybe try somebody else and see if they can help you more with your pain and then go for the decision. That's what my suggestion would be based on my 22 years of experience and treating almost 16,000 patients. Next question. You are assessing personally on May 4th. I had my treatment. Yes, our clinics are open from Monday. According to the Premier just announced yesterday, we are open to see regular patients from Monday. You can call the clinic to book your appointment. I have had sciatica issues for years, but my lower back pain seems to be correlated with poor core strength. Would strengthening core help? Of course. Again, core doesn't mean the muscles which are here. That's not the only core. You got core from there all the way down to your tailbone, and that's your core, right? I don't think just doing sit-ups is a core exercise. If I just move your arm and I'm doing that, that's a core exercise. My core activates first before I even lift my arm, right? There's different ways of doing core exercises. Definitely, strengthening your core will definitely help. First, get yourself assessed by a healthcare practitioner, your therapist, and then he will suggest you. There is also graded core stability program. You're not doing like just 10 exercises forever. No, we start with level 1, then we have level 2 core stability, level 3, level 4. We can increase that levels based on how we are doing and how we are graduating from the first level. Any other questions? Okay, I guess there's no more questions. Again, one more time, thank you so much. We will see you next month in another virtual webinar. Whatever the topic is, keep just looking at our Facebook page and keep in touch with us. Have a wonderful Friday for everybody. In India, it's night. Good night, guys. And for Canada and North America, it's morning. So have a nice day. Oh, I got one more question. Sorry. Do you use any electrical modalities to reduce pain? Yes, we do. If the pain is really acute, we do use mostly interferential current sometimes just to take the acute spasm out. That's all. Not all the time. Okay, guys, that's it. Thank you. Bye. Adios.